Dr. Harvey Estes is a legend at the Duke University Medical Center and Duke Medical School. And I met him 50 years ago when I was a first year medical student. And what Harvey taught me was what it meant to be responsible for people you're giving care for. Medical students had a volunteer clinic in the Edgemont section of Durham, open 2 nights a week. And our third and fourth year medical students would see the patients under the supervision of family physicians. And, we delivered pretty good care, if you will. But what Harvey reminded me is these individuals they deserve someone to be on call for them. They deserve a phone number they could call if they were having problems with their medication. And I worked with Harvey, and I worked with the Department of Family Medicine to actually set up a church that became our phone line and would relay the phone messages from patients to our student doctors, if you will. And when one of my friends nominated me for this Harvey Estes Community Service Award, it's just so wonderful to win an award for someone who you knew and someone who mentored you. And it really was recognizing not so much my work as a pediatrician and not so much my work as an epidemiologist in our community, but the different volunteer boards that I've participated on and the different work that we've actually done here at Urban Ministries. Harvey's definition of community health was something more than population health. It was a definition of do you belong to the community where your patients come from? Do you know that community so you know their circumstances? And I think if Harvey were still active today, he'd be saying, are we addressing the social determinants of health? Which is exactly what Urban Ministries of Wake County does. Our Helen Wright Center for Women is so much more than being a shelter. It's a housing program. And one of the determinants of health is how safe and how safe your neighborhood is, how safe your housing is, whether you can safely age in that place. So we're a housing program addressing a social determinant of health. Our open door clinic, you certainly could say, is providing health care, but with our nutritionists and with our diabetes educators and our hypertension educators and our behavioral health provider, we're doing more than saying, here's how you might treat your hypertension, or here's how you might treat your diabetes. We're partnering with people where they are at to be able to say, what works for you? Because it doesn't matter what my diagnosis is. What matters is, did my diagnosis fit your understanding of your illness? And does our treatment fit something that you would like to do? And among our programs that most obviously addresses the social determinant of health, it's clearly our hunger and nutrition program. We named it that way a couple years back on purpose. We wanted to use the word hunger to let people know that even in the wealthiest county in North Carolina, there are people who are hungry. There are families who are food insecure. There are individuals who aren't sure they can put a meal on the table for themselves and for their children. But we wanted to call it nutrition because over the past 10 years, we really have moved away from the cans that had a lot of salt in them or the product that had corn syrup solids in it. And certainly you can't get trans fat in your food anymore. Thank goodness they've removed that. But we wanted to make certain that the food we were serving people was food that would help them stay healthy, as opposed to food that might actually create you as a patient of the open door clinic at some time. And in these pandemic years, what I like to say is that we were there to be able to do best practice in food pantries by inviting people to come as often as once a week and pushing out the door these 28-pound boxes of healthy product, fresh frozen meat, milk, eggs, cheese, fruit, vegetables, and yes, there's always some boxes and cans, but we really were pushing fresh product out there that people could use and come as frequently as a week, because when food inflation's running 11%, you need to be able to ease what your paycheck can't actually fill, and we were doing that for you. The other thing that was stunning during the pandemic is we noticed some social workers from partner agencies coming through our drive-through, and when we asked what they were there for, they said, we have families where there might be only one car, and the breadwinner's using that car, and our families can't get to your food pantry when you're open. So we said, okay, well, what if we packed boxes for you? And at the peak of the pandemic, we were serving about 85 families a day through the drive-through, and an additional 150 to 180 families packing boxes that case managers and social workers picked up and delivered to those homes. I mean, it moved us from 23,000 duplicated count being seen maybe 7 years ago or so ago to 43,000 being seen in the pre-pandemic years to last year we literally served 70,000 individuals. It's a duplicated count, but that's allowed because that mouth needs to be fed each time that you feed it. So, I mean, it's something to be incredibly proud of that we were able to source product, we were able to continue to serve people who needed to come through a drive-through and get on with their day, but we had partner agencies who thought that it was important enough that they get food from us and bring it to those households so that people could have access to healthy food and ease some of the pain of supply chain issues and food inflation. It's a definition of community health to bring it full round to the Harvey Estes Award. I think we here at Urban Ministries practice community health, and I just happen to be the individual who the medical society decided to recognize. But it's an award that doesn't belong to me. It belongs to all of us.